Hi. So today I wanted to think a little bit around issues to do with gender and gender identity. Now I'm sure for everybody this is something that is more in the media and more in our attention than it perhaps ever used to be. I think I've been aware um, of people who have real struggles for a number of years now, because I've been working for the past 9 years in general practice looking after university students, and so that's naturally meant that there have been quite a number of my patients who have had issues around their identity, how they see themselves, struggles. Um, and people who are wanting to transition from being male to female, female to male, and everything that goes with that. I think from what I speak about today, I want to speak very much about some of the things that I've experienced and things I've learnt, and less perhaps about the real detail and medical detail and labelling detail, which you can find just by doing research yourself if you want to. So just a bit of background information. Gender identity is the gender that you identify with inside, and I suppose that's your sort of internal sense of what your gender is. Gender dysphoria is when your feelings and how you feel you should express yourself are different to the gender that you were assigned at birth. So it may be that you were assigned a gender of male at birth, but actually you feel completely different to that. You feel female. You feel female in your reactions. You feel female in how you respond to things. You feel that that's how you would want to live, that you're a female living in a male body, if you like. And that can mean that, especially during puberty, when you start to develop secondary sexual characteristics and your body changes, that can be really difficult for people who feel like they're female, but actually now their body is doing something very male. And that can be really hard. They want to get rid of the parts of their body that are identifying them as male. And they may want to develop parts of their body that they would identify as being female. And this can cause great distress for people. And one of the markers of gender dysphoria is that it causes a distress. It causes a real emotional and physical distress for the people that that's affecting. And I've seen that in the patients that I've seen in the surgery, particularly in student medicine. People who are very distressed by what's going on inside of them and how to manage that and navigate all those feelings that come with it. In terms of names for things, so transgender is a sort of umbrella term covering all aspects around gender identity issues. A trans man would be somebody who was given an assignment of female at birth, but feels that they're male and living as a male. Or a trans female would be a trans woman, would be somebody who was given a birth identity of male but feels that they're female and wants to live as and express as female. You may see something in the media called gender non-conformity. That's something different. That's more about behaviour, about how I guess we all do this to some extent, probably, or a lot of people do, behaviour that is not conforming with our gender. So I suppose going back many years, you could say, I know from my people of my mum-in-laws and my mum's generation, for women to wear trousers was quite a non-conformist thing to do. I mean, we'd find that odd in today's society, wouldn't we? But things where you're not conforming to your own gender in how you behave or dress or express yourself. And that's different to the distress that comes with the gender dysphoria. So for a lot of the patients that I see, I live in Sheffield, and in Sheffield we have one of the gender identity clinics in the UK. I think there's 9 or 10 of these clinics now. about that number in the UK, in the major cities, covering most of the areas around the UK. And certainly in Sheffield, I think that's actually attracted students to come to the city because there's a clinic here and they want to access what's available there. And the process for people who are thinking about transitioning to a different gender is that they have to have lived for a period of time as the opposite gender, and they can be referred to one of the gender identity clinics and consider options around physical changes to their bodies that transition into the different gender. And there's two things with that. One is hormone therapy, and the other would be surgical treatment. And obviously they're both massive steps. They're huge things to undertake, things that are irreversible and have huge changes in the physical body. I think one of the things that I've really felt for patients is that when they do get referred to the gender identity clinics, because there's so much pressure on the system, that often the process is quite fast, and I think there can be this feeling of pressure that somehow by making these physical changes, that's going to solve things for that person, solve the feelings of distress for that person. And so it can be that actually there's not that much input given into the psychological side of things, psychological distress, and maybe even things from the past that have contributed to distress for that person. And there can be maybe just one or two appointments, and then the person is fed into the system where they access the irreversible treatments. And we're already starting to see in the media some people who are challenging that. So there's been something in February of this year, if you look on BBC News, of a challenge to the Tavistock Clinic in London for the way that things were done and perhaps not as much information given as should have been. And I think that's probably going to happen more and more, because there's almost like this snowball effect where these things become available and it becomes maybe a bit more accessible, and people have this hope, because they're distressed, they have this hope that going down this line, that getting this treatment, getting the surgery is going to solve the distress that they feel. And I think the sad thing is that often those things don't solve the distress that they feel. I mean, I can think of one particular patient that I was looking after who was male transitioning to female, and actually had things from that had happened in their childhood that were really quite traumatic, and issues around sort of difficult family life, abuse, and those things actually hadn't been addressed for that person. The focus had actually just become on the gender dysphoria, on these distressed feelings around gender. And so they started down the whole process of irreversible change, and then suddenly realised that actually maybe this wasn't the answer, maybe this wasn't helping, maybe this now actually contributed to distress rather than solving it, because there were other things that actually needed to be looked at and would have been better to be considered before even thinking of going down that route. So, for example, it's well known that with gender dysphoria that there are often other things in terms of mental health links, so things like eating disorders or autistic spectrum disorder. There may often have been abuse in childhood, and they're massive things. They're massive things that have an effect on that person's sense of themselves and well-being. And if those things are not looked at as well or first, then it's really difficult. People can end up making unhelpful decisions and choices that actually lead to irreversible conclusions. And I think that's one of the real concerns that I would have after seeing quite a lot of these patients in my surgery, that there is a lot of distress. There's a lot of interconnecting things for that person, and unless they're treated as a whole and enough help is given for the different aspects, then there is the danger that actually they're going to be in a worse position than they were to start with. And I think we are seeing that as well, that there were some people now who are saying, you know, actually I think I made a bad decision and I want to transition back again, and they can look at that. But obviously that's difficult. That's really, really difficult. And we wouldn't want people to have to get in that position. That's years and years of distress added to things that they could have done without if maybe things had been looked at differently. So how can we best help people who have gender dysphoria, who have these distressed feelings about feeling different to the gender they were assigned at birth? I think I mean, obviously there is the medical help there. I think it's really important for people to start to think about their stories again. I keep coming back to stories, but thinking about, you know, what is it that's happened in their lives? What were their stories about? What was their family like? What were the messages that came to them? And actually taking time to think about stories and think about what effect those things have had on their identity and on their sense of self. So identity being our sense of self, our sense of who we really are. And actually taking time to think about our stories means that then we can maybe, instead of rushing into the gender side of things, that we actually take each bit and process and do things in a right kind of order. And it may well be that some of the gender issues get sorted as you address some of these other things as well. And so giving time to that, giving appropriate support and help and therapies around that is really important. Not rushing into something that's just obviously in front of us and in the media and at the forefront maybe of what people talk about at the moment. And I guess as well, I think thinking about our identity, thinking about our sense of self, who we really are, that I'm not just a physical body, I'm not just my body, I'm not just my emotions, I'm not just my feelings, I'm a spiritual being living in a body with these things. And my perspective in terms of bringing in the spiritual, I think, is really important, and maybe something again that we're not good at in the West, bringing in that spiritual sense of who we really are, and that we're each unique, valuable, created beings who live in our bodies and have all these things, and having a foundation of knowing that we're unique and valued and loved irrespective of what all those other things are is really important. Because then we have a foundation in which we can explore these other things in a safe kind of way without everything depending on them. So I think these are difficult things to talk about. They're difficult things for people to start to talk about who have these feelings inside, and it's good to have more open discussion and more open possibilities for people to discuss. But I think it's also important to be really careful that people don't get pushed down routes to treatments that ultimately aren't going to be the best thing for them. And I think that's where taking time with people and seeking good help for people is really important. In terms of resources, loads of things online. Just be careful which resources you look at. Use ones that have good background information, good scientific information attached to them. I mean, there's information on the NHS website, there's information on patient.co.uk. There's a good website called Living It Out, which is a website that is for Christians who have gender dysphoria and issues around that. And that's a really helpful website for anyone who wants to think about the spiritual side of things in an open and honest way as well. So I hope this just helps give a little bit of background and just a little bit of food for thought. I'll pop a couple of links on here as well so that you can access them if you want to.